Okay, we're good to go. So I'll just start briefly by saying thank you very much for attending. I see a lot of familiar faces, but for those of you who don't know, I am Ryan Mullins. I'm Corey's campaign manager, and I am basically just going to moderate this and start us out with a few just quick decorum and then let them go right into introductions. So we are going to have a few minutes for Corey to introduce himself and also for Rachel. I think Rachel's actually going to go first, so we have that order switched around, but they'll give a brief description of themselves and their connection and their feelings about this issue, and then we're going to go right into questions. We really want to leave this open for a conversation back and forth, so I don't want to take too much time, but just general rules on how we want to do this. You can either ask questions in the chat, you can privately message friends of Corey Mosher, which is the account I'm speaking on right now, or you can go ahead and raise your hand and I can call on you to say it out loud. It's up to you whether you feel comfortable speaking or if you would just like me to read the question. So you can either indicate that in a chat message or you can go ahead and raise your hand if that's your preference. But please feel free to ask as many questions as you want, directed at either Rachel or Corey, or just put out a general question. They're here to learn and to answer your questions about what kind of legislation is going on at the state level and what might be considered for the future. So this really should be very instructive and very constructive. So without further ado, then I'm just going to hand it over to Rachel so she can give a few quick remarks. Then we'll go to Corey and get right into questions.
Thank you so much, Ryan, and hi, everybody. It's great to see you all. I'm so glad you joined us on a beautiful summer evening. I'm Rachel May. I'm the state senator for the 53rd Senate District, so that includes all of Madison County, part of Onondaga County, and a sliver of Oneida County as well. And I am in my first term, and I chair the Committee on Aging, which means that a lot of issues related to coronavirus have been sort of front and center for me because of what's been going on in nursing homes and home care. And then I also chair the Commission on Rural Resources, which has been a very interesting learning experience for me. And I think we've been doing some really great work. And one of the great pleasures of my job was that I had Corey Mosher as my outreach director for Madison County, and got to work side by side with him and see what an amazing person he is, how knowledgeable, how dedicated, and just what a fantastic assemblyman he will be, I hope, as of November. So I won't say more. I'm looking forward to your questions. The theme is healthcare, but I imagine there may be some other questions too, and I'm glad to take those, given all that's going on right now. And with that, I'll turn it back to Ryan or over to Corey. I'm not sure what's your plan.
Just right into Corey.
Thank you so much, Senator. I really appreciate those kind words, and it was an absolute great thrill, and I learned so much working on your staff and how compassionate you are for constituents. Thank you so much for those really kind words. Hi, everybody. It's really good to see you tonight, see some faces, some familiar faces, and some that maybe I haven't had a chance to talk to yet. Tonight we are talking healthcare, as the senator said, though, if something else strikes your fancy, but how critical that conversation is about healthcare tonight. Very few times, right, have we seen where, the critical need for something, and we've all recognized how important our healthcare workers are, how they have stepped up and really put their lives and their work at risk, combating this virus, and at the same time, definitely with rural hospitals, do we see such large problems they have with ensuring that people are safe, their employees and their facilities are safe, providing that absolutely critical health care, while also finding themselves in financial trouble. As Community Memorial Hospital and other hospitals, they've had to postpone elective surgeries and things like that. That is their source of revenue. So they're faced with so many challenges, but I have been anybody that I talk to, whether it be nurses or doctors or healthcare administration, that no longer am I going to take for granted, and anybody I talk to, I won't take for granted their commitment and the work that they're doing. I think all of us have our eyes open about how critical their services are. So with that, I'd like to really open this up and encourage everybody. Listen, we're happy to answer questions and give you our viewpoints, but this is for us to learn as well. We want to hear from you about your healthcare stories. Everybody's got a healthcare story. What worked, what didn't work, what you're happy with, what you're not happy with. So please feel free to engage us and not just ask questions. Provide us some more context. With that, Ryan, if you want to open it up, I appreciate it.
Yeah, so I do have a question here from Eli, and he asks, do you support, this is for both of you guys, do you support the New York Health Act? And basically to go off of that, what will health insurance look like once the COVID crisis is stabilized?
You want me to take that?
Sure, go ahead.
So when I was running 2 years ago, that was one of my major planks of my platform. I believe that the New York Health Act is the right way to go. And now that we have seen what happens when millions of people lose their jobs and also lose their health care, I think more than ever the need for a universal health system is absolutely critical, and I think people are starting to recognize that. So the New York Health Act is a single payer plan. Everybody would be covered, and all of the costs that we now pay to the administration of health insurance would instead go to health care, and or nearly all of them. So that's a huge savings potentially, and also a way to cover people who might not be trying to get service. They might not be going to the doctor when they need to, and they're waiting until something becomes an emergency because they know that emergency rooms will take them even if they don't have health insurance. What we have is an incredibly inefficient system that also doesn't deliver good health care, and that is expensive and frankly not, I mean, the racial disparities we're seeing in the outcomes on COVID-19 are enormous, and they are an indicator of how just frankly unfair our current health insurance and healthcare system is. So I am a very strong believer in the New York Health Act.
Thank you, Rachel. As it came up in the debate the other day, Eli, what a great question to start with. I have not committed yet to the New York Health Act. I think we have to be thinking everything's on the table as we go through this crisis. I am, a lot of the way there when we talk about employee-based healthcare, and then you have 30 million people unemployed. I do think we have a broken system, and we need to really look at what options we have forward. Again, not committing yes or no yet, but I pledge to really study hard on what the New York Health Act is, and I appreciate the question.
Great. Do we have any other questions right now? Go ahead, John. Would you like to ask? You can unmute yourself.
Thank you. My question is a follow-up to that. As a retired teacher, I gave up a lot of money and salary that I might have made if I'd been a doctor or a lawyer for good health benefits. And as a former union president, I helped to negotiate those good benefits. So while I've always been a supporter of universal health care and single payer, I do have a concern that that plan wouldn't be as good as what I have now. And let me add that as a father of a 28-year-old daughter with spina bifida who's gone through the educational system and had to get all kinds of extra services. And one of my jobs now as a retiree is driving her and I to our doctor's appointments. So I'm very familiar with the healthcare system, and I know how much we fight with them now. And I don't want to buy into a system that's purportedly better and ends up being worse.
Right. So we had hearings about the New York Health Act this year that were really eye-opening for me. And I wanted to go there to really find out what are the pluses and the minuses. And no system is perfect. And I do want to say, John, what a hero you are for caring for your daughter. It sounds like she's doing, she's got a really great life that she might not otherwise have if it weren't for you.
Thank you.
But also anybody who's spent that much time in the healthcare system knows how expensive, how difficult it is, and how important it is to have good insurance. So one thing that happened at one of the hearings we had this year was there was the sort of governmental representative for the Teamsters was there to testify, and he was there to testify to what you're saying, that people in labor have negotiated away sometimes salary raises in order to get good healthcare benefits, and so they've made sacrifices for that and don't want to see those benefits go away. And as he listened to the testimony, and the testimony included people who had just heartrending stories about what had happened to their loved ones who had lost their health insurance, and also some really inspiring stories from business people who had employees in Canada and in the United States, for example, who talked about how much happier the people were with their health insurance in Canada than they were with their health insurance in the United States, and how much easier it was to administer, how much less time it took for the businesses to deal with the health insurance paperwork and everything else for the Canadian workers as opposed to the American workers. They really talked about how much more sensible a system it was. This guy from the Teamsters got up and he basically said, I'm here to testify against the New York Health Act, but I wish my entire membership had been here to hear this hearing and to hear all this testimony, because he couldn't say it, but what he meant to say was their minds would have been changed by hearing some of the stories that were told there. And one of the things I said to him, and I do believe this, I'm a very strong supporter of labor, partly because labor over the decades has made all of our lives better. It has given us the 40-hour work week and child labor laws and occupational health and safety laws and the weekend. And I asked him about this. I said, does labor want to be on the side of just, getting this benefit for themselves, or do they still want to be out there making the world better for everybody? And he had a job to do to stand up for what the union had told him to say, but he basically said, yeah, I agree with you that we should be working for what's best for everybody. So that doesn't entirely answer your question. We want to make sure that whatever the New York Health Act would come up with is as good as the health insurance you have. And that's the challenge in front of, that's the reason we're holding the hearings, for example, to make sure that we're
well, those plans are available for you to see, so you would know what kinds of things people have needed.
Right.
You could even ask local unions for their utilization of what things in the plan were used the most. Right. I think there's a lot, I guess I'm saying there's a lot of data available to formulate this plan that will make it palatable.
Yeah, well, the people who've been working on the plan for years have really done a good job with that, and they've recently been able to add long-term care in, which wasn't in there before, but which I think is a really important thing to include as well. But I hear you, and I do recognize there are people it's mostly the people who have the Cadillac plans who are the most worried about what this might look like, I think overall what you find in the countries that have single payer, it's about how the system is administered. It's not about how the healthcare is delivered. And so you would still have access to the doctors, the hospitals, that kind of thing. It's more about the insurance side of it, which honestly, you know, people may love their healthcare, but they don't generally love their insurance, you know, per se. Put it that way.
Thank you.
Mm-hmm.
Corey, did you want to chime in on this, or do you want to move to another question?
No, I just thanks, John. You know, as I mentioned earlier, you all have a healthcare story, and I couple what you just said with what we went through on our farm. You know, for years I didn't have health insurance because we couldn't afford it. And then when we got insurance, just, you know, our farm was only supplying insurance for maybe 3 employees at the time. It just was so expensive that when the Health Care Act passed and I was able to go on the exchange, not only did our small business, our farm, benefit from that. I remember the day my uncle was like, "Oh wow, well I can give you a pay increase now because we're not so weighted on healthcare, and we want to help contribute as much as possible." Um, just a light bulb went off for me that it wasn't only just helping me individually get into that because we weren't part of a larger group where we could get insurance, but it was also helping out our business. But it's so important to weigh that with your concerns, right? The experiences that you have in the making sure that we're going about this right the way, because this has to be it's got to be the biggest tent, right? It has to help everybody's story. So I just appreciate you bringing that up.
Great. So I do have a question here. I'll get to you in a second. Sorry, but I had one that came in through the chat. So from Chris Rossi, the role of rural hospitals has changed over the years. How do we keep local hospitals like Community Memorial in Hamilton strong and thriving? And I will say, Chris, we reached out to both Sean and Ivan. And unfortunately, both of them were unavailable, but they were very enthusiastic about being able to participate tonight. So they had a lot of great things that they wanted to be able to share. So hopefully Corey can cover some of that base, but we've been in communication with them as well.
Thanks for the question. You're right. How do we keep them viable, Chris? It's not only is it critical for the healthcare of our communities, but they're also sources of employment, economic drivers. It really is critical piece to our communities, and this cuts into a larger theme about our rural communities and making sure that we're helping support those things that help keep our communities viable. And I think rural healthcare and what these hospitals are doing are such a large and key piece of our community. So they need to be supported in whatever way they can. I think that's going to really take federal assistance. But man, to look at what they had to deal with even getting proper PPE through the COVID crisis, what a large hill we have to climb to make sure that their needs are being met and that we're helping support them. I do think though that we are entering a zone now where everybody understands their importance. So we need to be at the forefront of fighting for their support and federal funds or state funds, whatever that might look like.
Yeah, I agree with Corey that people are starting to finally understand just how important all of these critical services are, how important our frontline workers are, people, you know, doing all the kinds of jobs that we've taken for granted for so long, and suddenly realizing, wait, these are people, we really need them. So I'm hopeful that we're going to start something that I've been working on as chair of the Aging Committee and the Commission on Rural Resources, really trying to, even before the pandemic, beef up our the home healthcare workforce and the rural healthcare workforce, that these which have been neglected for so long and you know, you can't pay people enough to entice them to come and live in rural areas to work. And it's a really, really hard problem, but I'm kind of hopeful that one of the spillovers from what we've been going through is going to be that people are going to recognize that this is important. And we are also seeing telehealth become something easier to deliver. The doctors are figuring it out. The patients are figuring it out. It's becoming more, in some ways, doctors are becoming more accessible than they used to be. And I think that may help some of our rural health facilities, because access has been one of the problems. If you've got some kind of, if transportation is an issue, getting to a rural health facility can be really hard. And this way they can take more appointments and see more patients that way. So I think there may be things that are going to be helpful, but we've got to keep an eye on this and keep reminding people. I have to say, one of the things that I do in the Senate, because I'm the only member of the Democratic majority between Albany and Buffalo, I'm the only one who represents anywhere in the entire central part of New York State. So I spend a lot of time educating my colleagues about what are the issues of rural areas and the issues of small towns, and what it looks like to have a hospital in an area like Hamilton, New York. And so that is, I think in some ways that job is going to get easier. As I just really, people want to understand, and they want to know, and they want to be able to solve problems and not just watch them get worse. So I don't have specific answers about this, but I do think there's going to be the energy to tackle it.
Great. So we had a question from JNC Coulthard. I think that's how you say that. Would you like to go ahead and say it?
Yes, thank you so much. Jim Coulthard, I'm currently a city councilor for the city of Oneida. And much like the poor chap that Senator May spoke of, the Teamster, I come from a background of over 25 years in healthcare business and physician advocacy. Just to give it a little bit of context, Rachel, I was the guy that put together the Onondaga County legislative breakfast for 4 years before you got there. So very much work for special interests. And that's what I would tell anybody that would want to ask me, is that what's driving the healthcare now is special interests. And I really would like to see the idea that more hands make light work. If everybody participates in a healthcare program by having something they're paying into it, then we can all have something that we get out of it. And that's a dirty little secret that nobody wants you to know as a legislator, because they just as soon influence you and hopefully Assemblyman Mosher, to vote their way. I had a couple of questions I had was, so mentioning that you're part of the Senate majority Democrats for the first time in many years, what are the chances of something actually happening? That's number one. And number two is that I had hoped with the COVID that there would be a chance to come with some common pricing on providing services for operations and healthcare. How come I can go to Mavis Tire and know how much it's going to cost for me to have my muffler replaced and my brakes done, but it's a crapshoot if I go see a doctor who's a single practitioner at a small hospital or a large medical group that has a more favorable rate that I don't necessarily get as a patient. So those are some, why can't we just blend all of the usual and customary categories that we all know the actuaries at the insurance company are sharpening their pencils on? So sorry to throw a whole bunch of things at you. So starting with starting with what are the chances of this finally happening given the Senate majority? That's number one. Number two is what are the chances of pricing, common pricing, and maybe it's the whole state of New York. Since healthcare is one of those patchwork quilt things that were left to the states, to the colonies, because healthcare wasn't an insurance issue back 240 plus years ago. Why can't we put some common sense business practices to it? So I will shut up and let you talk.
Those are great questions. Thank you, Jim. So the New York Health Act you're talking about, if we have a chance of having it happen. So it's an interesting question politically. The New York Health Act passed the Assembly several years running before the Democrats got a majority in the Senate. And then when the Democrats got a majority in the Senate, all of a sudden it got taken off the table. And part of that was just because since they knew it wasn't going to pass in the Senate, they figured they'd vote for it without doing hearings or anything. Like, people weren't taking it that seriously and really trying to figure out, is this going to work? It was more of a symbolic vote that people were taking. And all of a sudden, when it became a possibility that it could actually become the law, people wanted to step back and really get it right. So last year I think there was general consensus that it wasn't ready for prime time, really ready to actually become the law. And so we've been holding these hearings, and I don't know what would have happened this year if we had had a regular session, according to the regular schedule. But I will be very surprised if there isn't much more talk about it next year after what we've experienced this year. Honestly, I think for a lot of people, including myself, I would rather see it happen at the national level. It's a little bit hard to do this kind of thing at the state level because there's a lot of permeability of the borders of the state, and if everybody's got a different system, it's hard to make a single payer system work. But that may be the national conversation too after this year. Your question about payments, though, is a really interesting one, and it partly comes back into the New York Health Act. I mean, part of the reason why I'm so supportive of this is that it takes the emphasis off of fee for service, which is what we have now in our health insurance system, and puts it on outcomes, basically, and on, paying for people rather than for services, let's say. And I really think we shouldn't be paying per service as it is. So you're saying, could we have a regular, payment schedule for the different services that are provided? And that's one way to do it, but that still runs into the problem of people overprescribing, whatever it is, CAT scans or something like that, things that make money for hospitals or doctors' practices or insurance companies, rather than pursuing a course that is the best thing for the patient. And I think, and the other thing we see with the fee-for-service model is that you get pressure on doctors to see more and more and more patients and spend less and less time with each one. And so those are the kinds of pressures I would like us to just take off. So we weren't doing it on a fee-for-service, but I agree with you, if we're stuck with fee-for-service, that we ought to make it much more transparent, and people should be able to make choices about, what their own care, and understand when the doctor is telling them this is what's happening, that understand what the bill is going to be. I've heard horror stories from COVID of people who were in the hospital for several weeks and came out and got a $400,000 bill for the service they've had. The system right now is just so opaque to people.
Right, special interest driven, Mike, is the way I put it. And I can tell you, those that may not know about this on the call, New York State doesn't have to worry about the surprise billing because we were years ahead of that in terms of getting those surprise bills from those anesthesiologists or other specialists involved when you had to be seen at the hospital. A lot of places are only now beginning to realize the benefit of no pre-existing condition exclusions. So New York State, there are those who say New York State's not a great place to be a business, but it's a great place to be a consumer. A lot of consumer protections built in. I guess what galls me the most, Rachel, about the scenario is, because you have pick a major medical group, AMP or Capital Care or whoever, wherever your area is, because they can ratchet down with the insurance companies, that we can, we will pay you, we'll guarantee you so many people come see you at such and such a price, then they get to have a better price for what they're paying for, but that doesn't necessarily reflect itself in the premiums that I pay as a patient / consumer. So that's what I'm looking at, and that's why I specifically use the Mavis tire muffler scenario. Why is it that there's so much of a what would you call it, a market, bazaar where you go in and haggle, do I hear 1, 2, 3, 4, why is that the case? Why is it that there's such that large spread of what could cost you? So it's a hairy monster. I realize that, and I appreciate it more than most, but I think that we're at a unique time now where seeing is believing. We're all living through this situation. The only part of that whole there are only two parts of that I have not worked for: the hospitals, and I've not worked for the pharmacy, or pharmaceuticals. But I've worked for all the other parts, and I am a consumer. So it's all about business. Marcus Welby doesn't exist anymore. Okay, it's all about the good ones. The good doctors are good, and they're busy. The ones largely that you see that are advocates what are they doing? They got time to advocate? I want my doctor with his or her head in the game of what I'm concerned about. So, okay, I will. So you're saying that there's a remote chance that some sort of single provider payer will happen, or start to happen, or not going to happen at all, or being punted down the road?
Well, it was definitely punted last year, and this year we just don't have the bandwidth to take it up, I don't think, in the legislature in this session. But I would be very surprised if it doesn't come up next year, unless it comes up at the national level.
Well, I thank you for your candor, and as I always tell my constituents, you may not hear the answer you want to hear, but you get an answer, and that I value the most. But are you listening, Corey?
Yes, I am. First I'll say, Jim, you're not haggling enough when you go get your tires changed, first and foremost. No, in all honesty, though, Jim, I really appreciate your insight on this. And, something that I talk about a lot in agriculture is we see farmers really struggle, right? And it is about the markets that we're in, and as we try to find markets to be successful with our operations. But we also talk all the time about, okay, find where the money is. There's money in the food system. There's lots of money in the food system. What is that percentage that is actually getting to those producers, and where are those bottlenecks at? And I think you can do the same thing for healthcare. For years and years and years now, we've talked about, problems with receiving care or how expensive it is. Everybody needs to be at the table, but I do know there's areas in healthcare that are bottlenecks, and we need to be holding those people to account and making sure we're putting in a system, whether it be within insurance or pharmaceuticals, that it's fair for everybody. So I really appreciate your insight.
Let me also say I talk to a lot of medical students because Upstate Medical University is in my district, and people going into medicine now are really hoping for something like a single payer plan, because they go into medicine because they want to care for people. And what they're seeing with doctors and other healthcare professionals now is that a huge amount of their time is spent being business people, figuring out the money, figuring out the billing. You know, they've got, most doctors' offices employ more people on paperwork than they employ on actual healthcare delivery. And that's not what they go into medicine to do. And what they'll say to you is, I want to be in a position where someone walks in my door and the first question we ask is, how are you? How can we help you? But right now, the first question is, how are you going to pay for it? That's always the first question when you go in the door of a doctor's office. And I just feel like we have to get away from that. We have to get to the care part, you know, more directly. Little by little, I'll convince Corey to.
Great. I see, Ellen, you have your hand raised. Did you have a question? You're muted. If you could unmute yourself, please.
Okay, sorry. We used to have a saying in advocacy a few years ago. You either have a place at the table or you're on the menu. So,
Ellen, go ahead.
Okay, well, I have a pie in the sky question, but I'll put that off because I think this conversation is very interesting. And I want to try to convince Corey of the model as well. We have some very interesting, they're no longer experimental healthcare programs that really serve rural healthcare very, very well. We have the data on that in the North Country, up in the Adirondacks, with Hudson Headwaters Health Network that has, in fact, turned the model to compensate doctors on outcomes rather than fee for service. So it builds in incentives for preventive health care, for a bit of Marcus Welby, that is a whole system and a whole team really working to benefit community health, family health, looking at households. It's very integrated. But the compensation, it's a radical rethinking of incentives for doctors and whole member and really team formation to really think about healthcare at the community level. I think it actually works ideally for rural healthcare, rural systems where health reflects so much of all matters of upbringing and the environment, and also distance. I actually think we have some really interesting experiments that are now really institutionalized in New York State that could really benefit Central New York. So it's a plug. I'm sorry, Brian, it's not a question, but I have another question, but I think
That's quite all right. Go ahead. Yeah, go ahead.
Well, no.
Wait, I have a question though. So you said that Hudson Health Partners?
Hudson Headwaters Health Network in Warrensburg. So it's the southeastern part of the southern, Glens Falls, Warrensburg, Queensbury. And this came out of Dr. John Ruggie, he became the only physician serving, so many kind of communities in the Adirondacks. And he just thought there has to be a way to flip this around. And it very much relates to issues of sustainable communities, because now the problem is, or the challenge is to attract doctors to be involved in the system. And so if you want to build a healthcare system, you have to have good school districts, you have to have good economies in rural areas, and so it's a very integrated system that is really now serves. I think they have 21 clinics all the way up to Plattsburgh and over to Indian Lake and Blue Mountain Lake. So it's a model really worth looking at, but the business model is completely flipped. The medical business model is flipped.
Right.
Thanks so much, Ellen. And yeah, I it's insight like that, and this is what this is about, right? I haven't made a decision on it because I know I haven't passed the threshold yet of knowledge to really make that decision. And please speaking up and giving me examples like that, because then I can go and make a really informed decision. So thank you. I really appreciate it.
Well, and then that takes me to my other, it's a question, but it begins with an illustration. So our friends at Bassett Healthcare are very interested, or have been, some of them very interested in the Hudson Headwaters model. And so to kind of, what's the word? I could think of an agricultural, image of, kind of planting the seeds of good ideas across this fantastic state that we have, upstate, to get the good ideas that exist elsewhere and then plant them. And that takes me to my question, and something that you've talked about, Corey, is, we're a rural region, but we're very dense in significant institutions, higher ed, hospitals, art institutions. I'm looking at Chris Rossi down there in the Fenimore Art Museum. How can we use our rich, I don't mean rich, but our high quality institutions to benefit rural healthcare? I mean, I work at Colgate. We're talking, and I'm involved with the, kind of COVID team right now. And every day we're talking to people in Wampsville, and we're talking to people at Community Memorial, at Hamilton Central School, about how we can protect each other going forward. When we bring, if we bring, 2,800 students back, how is it possible to protect our communities? And I'm just curious about, this is an example of where we are exchanging information. Can Rachel, Senator May, and soon to be Assemblyman Mosher, can you think about how we could tap those institutions? And that's my pie in the sky sort of question.
So can I start with that one? Because I love where Ellen is coming from. Ellen, that is such a key point, right? And the senator has done such a good job. Of any other senator last year, she had more of her counterparts visit this district than any other one in the state. And that's where it starts, right? To making sure, man, if I tell anybody else throughout the state, the district that has 5 colleges in it, they probably have no ideas and wouldn't believe that it would be in this rural district. I mean, that is very, very important education that needs to go on. And it comes from the passion that all of you have for this district, and conveying that and talking about how important it is, that it's understood what's here first and foremost, and how valuable that is to our community. Because only with that, and only can we start kind of showcasing that and explaining that to other people, that then people understand those networks, and then it's amazing in Madison County, some of the talent that I've seen that are actually looked at leadership in the state. Whether it be at the county level with what we have in our health department, or again with our colleges. There's really fabulous talent here, and it's our job, I think, to represent that, right, and to make sure that we showcase that and communicate that. And I'm so optimistic about where that is going to lead us, because I think as we really fight for this district and getting things like rural broadband accomplished, it's going to help really showcase that even more, and then bring more of that talent to our district.
Yeah, it's a wonderful question, and I'm going to need to think about it more. How do we make use of all these great institutions to then lift up the healthcare side of it? So Corey has 5. I've got 9 colleges and universities in my Senate district, and I've been a little terrified during the COVID emergency that the impact this is going to have on higher ed in particular, because those 9 institutions are the backbone of 5 or 6 whole communities within the district. And if they, fail, which isn't totally out of the realm of possibility, then the communities go with them. So I've been working really hard on this idea, how we bring those. We had a roundtable week to bring people from all the institutions together to talk about how can all the institutions help each other take this as a whole ecosystem of higher ed and make sure that we're, doing what is necessary to bring all the students back safely and to keep all of these institutions healthy. It probably would be smart to bring the hospitals and some of the other institutions together as well and see, can we think globally as a region about. One of the things I was thinking was, well, I'm hopeful that students thinking, should I come back to Colgate this year, that it might make it easier for them if they're thinking there's, all these other institutions in the area that are all thinking together intelligently about how to make this safe. And not just safe, but how to make it a good experience for the students to be in this region. But you're right, we could be doing that. We could be sort of capitalizing on the fact that we have such a range of great institutions to figure that out in a broader way. But I'd love to talk with you more about what your thoughts are on that. It's going to take me a while to process it, to figure out what we could do with that. But I love that way of thinking.
And we're all living through it right now. I mean, we're kind of making this all up as we go along in terms of, because it's such a new health landscape when you think about a virus really wiping out economies and or challenging economies. So it is new. It's a brave new world in that regard, isn't it?
Yeah.
I just want to bring up one other thing too that hasn't been mentioned yet. When we talk about healthcare, obviously our minds go directly to our institutions and our hospitals. But I would add, it's so critical. We live in an agricultural community in this district in Madison County. But it's very safe to say that in certain stretches of this county, they actually are in food deserts because their access to that food, you have to travel very, very far away. So I think we need to be really cognizant too of healthcare as a whole and access to healthy food. And again, making sure that what we are very good at in this district we have better access to it, across the board.
Absolutely. So I see that, Eli, you have another question, but before I give you a chance to go ahead again, does anybody else have something they want to say here? We're getting close to the hour mark.
Well, that went fast.
Yeah, I know. Good conversation. It's taken up the good amount of time here. So Eli, why don't you go ahead and ask the final question here? You're going to need to unmute yourself, though.
Okay. Can people hear me?
Yes.
Okay. So my question is kind of a two-parter, and it's for both Mosher and May. So my grandfather is a therapist, and he has trouble getting around and walking. So, and his office in Hamilton is takes 19 steps to get to his office. So that's not really great. So when this coronavirus thing happened, well, before that even happened, he was trying to get help to so he could stay home and telemedicine, but most of the insurance companies wouldn't really let that happen. But once coronavirus affected everything, I think Cuomo made them, because they had to, made them insure telemedicine. So my questions are, do you support expanding mental health services by making permanent teletherapy coverage for all health plans that would increase access to care for rural upstate New Yorkers? And my second question is, do you support expanding high-speed broadband to rural areas to ensure telemedicine and teletherapy access for rural upstate residents? And if so, how would you do this?
Ooh. All right, we got 7 minutes to solve the world's problem. Great question, Eli. And good to see you again. I think we met, I'm trying to remember when we met before, but I know I've seen you.
My grandfather's town of Lebanon supervisor's office.
Oh, that's right, that's right. So I'm so glad you're here again. So telehealth, expanding it to mental health, I think some of that has already been done, but yes, we definitely need to do that. And I think there is legislation of that sort already in front of the legislature. I know we passed a bill 2 weeks ago that makes sure that telehealth and telemedicine is eligible for reimbursement with insurance, because if some insurance just doesn't cover it. But I honestly don't know if that included mental health. Eric Vandervoort's on this call. He's my legislative director, and he might pipe in here now with an answer to that, but I don't know. Eric, do you know?
I don't think so.
Okay, well, that's something that we should make sure is happening. In terms of broadband, that's been a very high priority for me. It's a real frustration that Madison County has some of the biggest broadband deserts in the state. We've been working on it. We have various kinds of legislation, but also we held a hearing that was really important for gathering information about what's missing and where the holdups are. The governor put a bunch of money into making sure everyone had high-speed internet in the state, but the governor's office seems to think that they've solved that problem, and the hearing was really important for impressing on them that it's far from being solved. And it isn't just for telehealth, for kids in school and for people who need cloud-based services for their agricultural work, or their, processing transactions at their store or something like that. So it's a very high priority for me. How you do it is really hard. It's very expensive to get it to that last mile to remote locations. But we're getting there. And I wouldn't mind if Eric weighed in about where we are, but let's let Corey talk about it too.
I appreciate it, Eli. It's vital. I would step it up and say it's vital, and add that with everything that Senator May said how important it is, I would also add that it's so important for our future and our competitiveness, if you would. Our kids are going to fall behind if they don't have access to broadband. Medical professions, right, as we move into that arena are going to fall behind. So it's critical for our area in order to remain competitive and retain its residents. 5 colleges and universities is great, but if you're not retaining that talent that goes through it, that's another source of people as they come into this area and learn this area. You're not going to be able to keep them unless you can provide that service. So it's extremely important, Eli. And I appreciate all the education that I've gotten from your grandfather. Mr. Goldstein, as supervisor, is really passionate about it and has been great in kind of cluing me in on some of the troubles he's had in working with insurance companies in the state. So yeah, I appreciate he's passing a lot of that fire on to you, Eli. I love it.
Great. Well then, that is our hour. So do you guys have any final thoughts you want to share before we wrap up here?
Sure, I'll start, Senator. I'll give you the last word. A big thank you for showing up. I really, this is the 3rd one we've done, And like Senator said, I get to the end of it, I'm like, oh my gosh, we're just starting. So please continue this conversation. It is so helpful for me to hear your stories and understand this better as we go forward. And we really want to encompass all of this in our decision making. So please keep up the good work, and thank you a million times for being here tonight. And thank you, Senator.
Oh, my
Thank you very
pleasure. Thanks
much.
for inviting me. This has been lovely, and I really appreciate all your questions. I guess the last word that I want to have is this. So I represent the city of Syracuse in addition to all of Madison County. So I think I have one of the most diverse districts in the state in terms of representing city and suburb and rural areas and all of the issues that they have. But one of the things that I've learned in the process of representing this district is that the problems really are not all that different. Broadband access is a problem in a lot of neighborhoods in Syracuse, as it is in some regions of Madison County. And everybody wants good schools, and everybody needs access to good, healthy food and to good health care. And these problems are pretty much universal throughout my district. And so I think we tend to hear a lot about divisions in the state and divisions between rural and urban and that sort of thing. And I'm here to say that our interests and our concerns really are the same interests and concerns. And I have to say, it's been beautiful to see some of the protests that we've had about Black Lives Matter that are happening in rural areas. Rome, New York had a gigantic protest bigger than the one in Syracuse on Saturday. So I think we're all understanding that we're one big family, and we have to solve these problems together. As Ellen said, we can bring all these different institutions together, but we have to be bringing each other together too. And I just appreciate all of you being here, and look forward to continuing working with all of you and hearing from you about the issues that matter to you. And Eli, I don't know, Corey, he's going to be running for your job. But if you win, you're going to have to do a really good job, because Eli's going to be there in just a few years running for assembly, I think. Anyway, thank you all. Thanks, Ryan, for organizing this.
Yeah, thank you so much for joining. It's always such a pleasure to hear you speak. I know you're actually my senator, and I'm very proud for that. So I'm very glad that you could join us, and this was a wonderful conversation. So thank you all.
Eli, run for Senate.
Yeah.
Oh, no!
All right.
Maybe
Well,
both. Maybe both.
All right.
I appreciate you all taking the time to join us tonight. So thank you once again, and good night.
Bye, everybody.
Bye.
Bye, thank you.